Hi all, welcome back to my channel. So today I'll be discussing how to rehabilitate a child with deafness. A diagnosis of a deaf child is a catastrophic event in the life of new parents. So it is never easy for any clinician to break the news to new parents that the child cannot hear. But it is at the same time very important to start the rehabilitation as early as possible. So what are the investigations that we'll be doing once a child has been diagnosed as deaf so that the rehabilitation process is smooth? At first, you will get a detailed pediatric evaluation of the child done to rule out if there is any other systemic involvement there. Then we also get a vision testing done for the child to make sure that the vision is not impaired for the child, as vision has a very important role in rehabilitation of a child with deafness. Even after the child has started using hearing aids, the child is using a cochlear implant or any implant, but still visual cues are very important in the path of rehabilitation. The other testing that we get done are genetic testing to rule out if the hearing loss the child has is part of any syndrome, if there's any underlying syndrome that the child has. The earlier the child has been started on a hearing rehabilitation, the better will be the outcome for the child in terms of speech, in terms of interaction with others, in terms of his or her scholastic performance. So why do we stress out on this point that the earlier the rehabilitation the better? Because the auditory cortex, the part of the brain that receives the sound impulses, if it is deprived of any stimulation for a longer period, that part just shrinks and atrophies. So the earlier we start giving input to those to that cortex, the better it will be for the child. And if we are on time, like by 6 months of age, the child should have been started on hearing aids. By 12 months of age, we should get a cochlear implant for the child. In these ideal scenarios, the child will have a very comparable scholastic and social outcomes as a child who doesn't have any hearing loss. So first let me discuss about hearing aids. So the hearing aids mainly help in a child with severe hearing loss in continuously giving some auditory input, some noise, some voice to the auditory cortex, so that we can buy some time for the main surgery. Then there are different types of hearing aid which is available. One is behind the ear, in the canal, completely in the canal types of hearing aids. This is a decreasing order of the size of the hearing. Then the doubt arises whether the hearing aid should be used in one ear or should be used in both the ears. Ideally, the hearing aid should be used in both the ears. If we are using hearing aid in both the ears, then that helps in localizing the sound, whether it is coming from the right or from the left. But yes, the child will have difficulty in understanding the sound, even if the child is using hearing aid in both the ears, localizing whether the sound is coming from the front or from the back or from the up or from down. But yes, with hearing aid in both the ears, the child will be able to localize whether it is coming from the right or from the left. This also comes with improved sound quality, like if one hearing aid is damaged, the other hearing aid is always there. Then what the precautions that the parents should take while the child is using a hearing aid. There's a battery in the hearing aid, so we have to be careful with that device. There is a chance if the child is very small, there's a risk of the hearing aid ear mold and ingestion. Then if a child is exposed to very loud noise, that will be severe discomfort for the child. And also if the amplification is not working enough, the child will not hear anything, and warning sounds, these are going to be missed for the child. And the child will not gain much from the hearing aid if the amplification part is not enough. Then coming to cochlear implant. So what does a cochlear implant do? Cochlear implant is an implantable process. It has a wire which directly goes and stimulates the cells of the cochlear nerve. So the prerequisite for a cochlear implant, that the nerve has to be there, cochlear nerve has to be present. So the factors which determine in a child when a cochlear implant can be done is whether the child has any other systemic illnesses, cardiac illnesses which can delay the surgery, then whether the anatomy of the inner ear is normal or not for the child, as I mentioned, whether the nerve is present or not, and the age of the child. If the child is more than 5 years of age, the government of India doesn't provide financial aid for those children who are more than 5 years of age. So age is also a factor which has to be kept in mind. So when a child has severe to profound hearing loss, which prevents a child from attaining age appropriate speech, social skills and language, that's an indication to get a cochlear implant done. So the children, like in hearing aid, those who use cochlear implant, those who have cochlear implant in both the ears, have superior performance than the ones who have cochlear implant only in one ear. So the the difference between a child getting a cochlear implant in one ear and the other ear should be, if it is kept within 1 year, that will be better than if it is delayed further. So the gap between getting two cochlear implants, ideally it should be either simultaneous or within 1 year. If it is not possible, then the duration has to be cut short, but it should not go beyond 4 or 5 or 7 years. Otherwise, the other part which has not received cochlear implant, it will not it will not benefit after a long interval. Then there is another entity known as bone connection hearing aids. Bone connection hearing aid, in which a machine is attached which is directly stimulating the cochlea through the bone, and this is for the kids who have a malformed external ear, middle ear, who have discharging ear, those who do not have a dry ear. As those with cochlear implant, they should not be having any mid-ear infection. That's also prerequisite for cochlear implantation. So the kids who have continuous discharging ear and malformed ear, and those who are not gaining much, or they are not able to continue with a hearing aid, so another option is a bone connection hearing aid. But to use a bone connection hearing aid, the child should be at least 5 years of age to get the adequate thickness of the bone. So what about the children before 5 years of age? So as we have mentioned earlier, the rehabilitation better is the outcome. So in these kids, we use a thing known as soft band. Soft band is like a hairband, and the stimulated part will be near the mastoid part, that is where the hearing apparatus is present, and that will directly stimulate the inner ear. But yes, it is not as a bone anchored hearing aid or cochlear implant, but it serves the purpose of providing auditory input to the brain till the child is fit for a surgery. The next is auditory brainstem implant. So these implants are designed for kids who do not have a cochlear nerve, and these electrodes directly go and stimulate the nucleus, that is the brain part which is responsible for hearing sound. So this doesn't have a superior outcome than a cochlear implantation, and this is a high-risk surgery per se to undertake. And the rehabilitation process for a brainstem implant is much longer than a cochlear implant. Along with these implants, there are many other implants known as cross hearing aid, mid-ear implants. So with this, I conclude my video. I hope it has shed some light into the rehabilitation process of a child with deafness, and a diagnosis of a deaf child should not sound as catastrophic as it should be, as there are so many options available for us. So the only thing is that there should not be a delay in rehabilitating a child with deafness. So we should give them the right to choose, the right to hear. Thank you.